Hygiene and public health. This video is property of Ravzer. Historical development of hygiene and public health in naturopathy. The historical development of hygiene and public health in naturopathy can be traced back to ancient civilizations where natural methods and principles were employed to maintain health and prevent disease. Key milestones include 1. Ancient practices. Many ancient cultures, including the Greeks, Egyptians, Chinese, and Indians, emphasized natural remedies, diet, exercise, and cleanliness to maintain health. Hippocrates, the father of medicine, advocated for natural healing and lifestyle modifications. 2. 19th century nature cure movement. The modern naturopathy movement emerged in the 19th century, with figures such as Vincent Priestnitz, who promoted hydrotherapy and the use of fresh air, water, and a natural diet for healing. Sebastian Kneipp further developed these ideas, integrating herbal medicine, exercise, and hydrotherapy. 3. Benedict Lust and naturopathy. Benedict Lust, often considered the father of modern naturopathy, brought these European nature cure practices to the United States in the early 20th century. He integrated various natural therapies and emphasized the importance of hygiene, diet, and lifestyle in maintaining health. 4. Public health integration. Throughout the 20th century, naturopathy increasingly incorporated public health principles, emphasizing the prevention of disease through natural means. This included promoting clean water, adequate sanitation, proper nutrition, and healthy lifestyles. The role of naturopathy in promoting community health and preventing diseases. Naturopathy plays a significant role in promoting community health and preventing diseases through its holistic and preventive approach. Holistic approach to health. Naturopathy emphasizes treating the whole person, body, mind, and spirit, rather than just addressing symptoms.
Disease prevention. Naturopathy focuses heavily on prevention, educating communities about balanced nutrition, regular physical activity, adequate sleep, stress management, and avoiding harmful substances to prevent chronic diseases.
Natural therapies. Naturopathy employs natural therapies, including herbal medicine, nutritional supplements, acupuncture, and hydrotherapy, to support the body's innate healing processes and resilience.
Public health education. Naturopaths engage in community programs, workshops, seminars, and public talks on nutrition, stress reduction, detoxification, and natural remedies to empower individuals.
Personalized care. Naturopathic practitioners provide personalized care plans tailored to individual needs, considering genetics, lifestyle, environment, and emotional health.
Community-based programs. Naturopathy integrates with community programs, community gardens, fitness groups, and stress management workshops to promote healthier lifestyles and social cohesion.
Collaboration with other health professionals. Naturopathic practitioners often work alongside doctors, dietitians, and mental health professionals to provide comprehensive, well-rounded care.
Promotion of sustainable health practices. Naturopathy advocates sustainable, environmentally friendly practices, organic foods, reducing toxin exposure, and conserving resources to support community health.
Focus on mental health. Mental health is central to naturopathic care. Mindfulness, relaxation exercises, and counseling support emotional well-being and disease prevention.
Advocacy for health policy changes. Naturopathic practitioners advocate for policies that promote preventive care and natural therapies to create a healthcare system prioritizing holistic health.
The principles of personal hygiene. Personal hygiene encompasses a range of practices aimed at maintaining health and preventing disease through cleanliness and healthy living habits. Here are the key principles. Cleanliness. Hand hygiene. Regular hand washing with soap and water to prevent the spread of germs. Oral hygiene. Brushing teeth at least twice a day and flossing to maintain oral health. Bathing. Regular showers or baths to remove dirt, sweat, and bacteria from the skin. Nail care. Keeping nails clean and trimmed to prevent the accumulation of dirt and bacteria. Diet. Balanced nutrition, consuming a variety of foods to ensure adequate intake of essential nutrients. Hydration. Drinking sufficient water daily to maintain bodily functions and overall health. Moderation. Avoiding excessive intake of unhealthy foods high in sugar, salt, and unhealthy fats. Regular meals. Eating at consistent times to maintain stable blood sugar levels and energy. Exercise. Regular physical activity. Engaging in at least 150 minutes of moderate intensity aerobic activity, or 75 minutes of vigorous intensity activity each week. Strength training, including muscle strengthening activities at least twice a week. Flexibility and balance, incorporating stretching and balance exercises to improve overall physical fitness. Mental health. Stress management, practicing techniques such as mindfulness, meditation, or yoga to manage stress effectively. Adequate sleep, ensuring 7 to 9 hours of quality sleep per night to support mental and physical health. Social connections, maintaining healthy relationships and social interactions for emotional well-being. Mental health awareness, seeking professional help when needed and being aware of signs of mental health issues. Environmental hygiene, clean living spaces, regular cleaning and disinfecting of living areas to reduce exposure to harmful microorganisms. Proper waste disposal, safe disposal of household waste to prevent contamination and disease. Personal belongings, regular cleaning and maintenance of personal items like clothes and bedding. Preventive health measures. Vaccinations, staying up to date with recommended vaccinations to prevent infectious diseases. Regular checkups, routine medical, dental, and vision checkups for early detection and prevention of health issues. Hygiene education, continuous learning and adopting new hygiene practices as needed based on health recommendations. Personal grooming, hair care, regular washing, combing, and trimming to maintain cleanliness and appearance. Skincare, using appropriate skincare products to maintain skin health and protect against damage. Clothing, wearing clean and suitable clothing for different activities and weather conditions to ensure comfort and hygiene. Sexual health, safe practices, using protection during sexual activity to prevent sexually transmitted infections and unintended pregnancies. Regular screening, undergoing regular health screenings for STIs and other related conditions. Informed decisions, educating oneself about sexual health and making informed choices. Ergonomics and posture, proper ergonomics, setting up workspaces and living areas to support good posture and reduce the risk of musculoskeletal problems. Posture awareness, practicing good posture while sitting, standing, and moving to prevent strain and injury. Respiratory hygiene, cough and sneeze etiquette, covering mouth and nose with a tissue or elbow when coughing or sneezing to prevent the spread of respiratory infections. Ventilation, ensuring good ventilation in living and working spaces to reduce the risk of airborne infections. Eye care, screen time management, limiting time spent on screens and taking regular breaks to reduce eye strain. Protective eyewear, using appropriate eyewear to protect eyes from harmful UV rays and potential hazards. Hearing care, noise control, protecting ears from excessive noise levels by using ear protection in loud environments and keeping the volume at safe levels when using headphones. Foot care, proper footwear, wearing shoes that fit well and provide adequate support to prevent foot problems. Foot hygiene, keeping feet clean and dry to prevent fungal infections and other foot conditions. Health literacy, informed choices, staying informed about health issues, treatments, and preventive measures to make knowledgeable decisions about personal health. Critical thinking, evaluating health information from reliable sources to avoid misinformation and health myths. Alcohol and substance use, moderation, limiting alcohol intake and avoiding substance abuse to prevent health issues and dependency. Awareness, understanding the effects of alcohol and substances on the body and mind. Emotional wellness, self-care practices, engaging in activities that promote relaxation and joy, such as hobbies, nature walks, or creative pursuits. Emotional expression, finding healthy ways to express and manage emotions, whether through talking, writing, or art. Preventive health screenings. Regular monitoring, keeping track of health indicators such as blood pressure, cholesterol levels, and blood sugar to catch potential health issues early. Personalized screening, participating in health screenings based on age, gender, and risk factors. Environmental hygiene is a crucial aspect of public health that focuses on maintaining and improving the quality of the environment to prevent disease and promote health. It encompasses various components, including air quality, water quality, and sanitation. Here's a detailed discussion on the importance of each. Poor air quality can lead to respiratory diseases such as asthma, bronchitis, and COPD. Fine particulate matter, PM2.5, and other pollutants can penetrate deep into the lungs and enter the bloodstream, causing various health problems. Air pollution is also linked to cardiovascular diseases like heart attacks and strokes. Emerging research suggests long-term exposure may be associated with neurological disorders, including cognitive decline. Children, the elderly, and those with pre-existing conditions are especially vulnerable. Contaminated water can carry pathogens causing cholera, dysentery, typhoid, and hepatitis A. Ensuring clean water prevents these illnesses. Water pollution from industrial waste, pesticides, and heavy metals can cause chronic health issues, including cancer and developmental disorders. Access to clean water supports hydration and food safety. Poor water quality also creates economic burdens from healthcare costs and lost productivity. Proper sanitation helps prevent the spread of infectious diseases by reducing human contact with pathogens. Adequate sanitation facilities protect dignity and safety, particularly for women and children. Effective waste management preserves ecosystems and prevents contamination of water and soil. Sanitation is a core component of public health infrastructure that supports broader health interventions and community well-being. An integrated approach to environmental hygiene includes implementing and enforcing regulations to control pollution and ensure safe drinking water and sanitation. It requires public education and community engagement and the use of technological innovations to improve air and water quality and sanitation infrastructure. Together, these elements prevent disease, promote health, and enhance quality of life. Public health concepts. Epidemiology. The study of how diseases spread, their patterns, and the factors that influence their distribution within populations. Key elements. Incidence, the number of new cases of a disease in a specific time period. Prevalence, the total number of cases of a disease at a particular point in time. Risk factors, conditions or behaviors that increase the likelihood of developing a disease. Outbreak investigation, identifying the source and controlling the spread of disease during an outbreak. Surveillance, continuous monitoring of disease occurrence and spread to inform public health action. Disease prevention involves measures taken to prevent the onset, progression, and recurrence of diseases. Key types. Primary prevention. Actions taken to avoid the occurrence of disease, e.g., vaccination, healthy lifestyle promotion. Secondary prevention. Early detection and prompt intervention to control disease progression, e.g., screening programs. Tertiary prevention. Measures aimed at reducing the impact of ongoing illness or injury that has lasting effects, e.g., rehabilitation programs, chronic disease management. Health promotion focuses on enabling people to increase control over and improve their health. Key elements. Education, informing and empowering individuals about health behaviors and choices. Community participation, engaging communities in identifying and addressing their health needs. Policy making, creating policies that support healthy environments and behaviors, e.g., smoke-free laws, nutrition labeling. Supportive environments, creating environments that make healthy choices easier, e.g., safe parks, accessible healthcare. Holistic approach, considering physical, mental, and social well-being in health initiatives. Social determinants of health conditions in which people are born, grow, live, work, and age that affect health outcomes. Key factors: economic stability, income, employment, and financial resources. Education, access to quality education and educational opportunities. Social and community context, social support, community engagement, and discrimination. Health and healthcare, access to healthcare services and health literacy. Neighborhood and built environment, housing, transportation, and environmental conditions. Health equity, ensuring that everyone has the opportunity to attain their highest level of health, regardless of social, economic, or demographic factors. Key elements: fairness and justice, addressing disparities and ensuring fair treatment. Access to resources, ensuring equitable access to healthcare, education, and other health-promoting resources. Cultural competency, providing care and services that respect diverse cultural backgrounds. Public health policy refers to the laws, regulations, and policies enacted to protect and improve the health of the population. Key components: legislation, laws that regulate health behaviors and conditions, e.g., tobacco control laws. Regulations, rules and standards to ensure safe and healthy environments, e.g., sanitation standards. Public health programs, initiatives designed to promote health and prevent disease, e.g., immunization programs. Global health focuses on health issues that transcend national boundaries and require international cooperation. Key issues: infectious disease control, managing diseases that can spread across countries, e.g., HIV/AIDS, malaria. Health systems, strengthening, improving healthcare infrastructure and systems in low and middle-income countries. Global health security, preventing and responding to health threats that impact global stability, e.g., pandemics. Environmental health examines how environmental factors affect human health. Key areas: air and water quality, monitoring and controlling pollutants to ensure safe air and water. Toxicology, studying the health effects of chemical exposures. Occupational health, protecting workers from health hazards in the workplace. Biostatistics involves the application of statistical methods to analyze and interpret public health data. Key applications: data analysis, interpreting data from epidemiological studies and health surveys. Statistical modeling, predicting health trends and outcomes. Evidence-based practice, using statistical evidence to inform public health decisions and policies. Health communication, the practice of promoting health information and behaviors through various communication strategies. Key strategies: public awareness campaigns, informing the public about health issues, e.g., anti-smoking campaigns. Risk communication, communicating risks and prevention measures during health emergencies. Health education materials, developing pamphlets, websites, and other resources to educate the public. Relationship between public health policies and naturopathic practices.
Public health policies and naturopathic practices intersect in several ways, reflecting both the integration and divergence of conventional public health approaches and natural healing methods.
Complementary approaches, integration with public health goals. Preventive care. Both public health policies and naturopathic practices emphasize prevention. Naturopathy focuses on maintaining health and preventing illness through lifestyle changes, diet, and natural remedies, which complements public health goals of reducing disease prevalence and promoting overall wellness. Education and awareness. Naturopathic practitioners often engage in educational activities about healthy living, nutrition, and natural therapies. This aligns with public health initiatives aimed at increasing health literacy and empowering individuals to make informed health choices. Support for chronic disease management. Chronic conditions. Naturopathic approaches can support the management of chronic conditions such as diabetes, hypertension, and arthritis. Public health policies often include management strategies for chronic diseases, and naturopathic practices can provide complementary strategies for symptom management and overall well-being.
Divergence in principles and practices. Different philosophies. Holistic versus conventional. Naturopathy emphasizes a holistic approach, focusing on treating the root causes of illness and considering the whole person, body, mind, and spirit. Public health policies are often based on epidemiological evidence and may prioritize interventions that address broader population health trends, which may not always align with holistic principles. Evidence and regulation. Scientific evidence. Public health policies are typically based on rigorous scientific research and evidence-based practices. Naturopathy, while incorporating evidence-based methods, also includes traditional practices that may lack the same level of empirical support. This can create tension between conventional public health approaches and some naturopathic practices. Regulation and standards. Public health policies are usually governed by standardized regulations and guidelines. Naturopathic practices, however, can vary widely in terms of regulation and standardization, leading to differences in how treatments and practices are implemented and evaluated.
Potential for collaboration-integrated healthcare models. Collaborative care. There is potential for integrating naturopathic practices within conventional healthcare systems, leading to collaborative care models. For example, naturopathic practitioners can work alongside conventional healthcare providers to offer complementary therapies that enhance patient outcomes. Policy support for integration. Public health policies can support the integration of complementary and alternative medicine (CAM) practices by encouraging research, setting standards, and promoting collaboration between different healthcare providers. Research and evidence generation. Shared goals for research. Both public health and naturopathy benefit from research that explores the efficacy and safety of various treatments. Collaboration in research can help bridge gaps in evidence and contribute to a more comprehensive understanding of effective health interventions. Challenges and opportunities. Challenges. Professional boundaries. There can be challenges related to professional boundaries and scope of practice, particularly when integrating naturopathic practices into mainstream healthcare systems. Insurance and accessibility. Differences in insurance coverage and accessibility can affect how naturopathic practices are utilized within public health frameworks. Opportunities. Holistic wellness. Initiatives. Public health policies can incorporate holistic wellness initiatives that align with naturopathic principles, such as promoting mental health, stress reduction, and preventive care. Policy advocacy. Naturopathic practitioners can engage in policy advocacy to promote the inclusion of complementary therapies in public health strategies, fostering a more integrative approach to health and wellness. While public health policies and naturopathic practices may differ in their approaches and principles, there are areas where they can complement and enhance each other. Collaboration and integration can lead to more comprehensive and effective health strategies, benefiting both individual patients and public health outcomes.
Naturopathic approaches to disease prevention and control encompass a broad range of practices aimed at promoting overall health and enhancing the body's natural ability to resist and recover from illness.
Immune support strategies. Probiotics. Consuming probiotic-rich foods or supplements can enhance gut health and support the immune system. Herbal immune boosters. Herbs like astragalus and reishi are used to strengthen immune resilience.
Improving indoor air quality with purifiers and ensuring access to clean, filtered water help reduce exposure to airborne and waterborne pathogens.
Public health education and awareness programs, teaching safe food handling and vaccination basics, can help reduce the spread of communicable diseases.
Adaptogenic herbs like ashwagandha and holy basil help the body adapt to seasonal changes and stressors, supporting immune function during high-risk times.
Personalized nutrition plans and lifestyle modification counseling help manage chronic diseases. Tailored diets for diabetes and anti-inflammatory strategies for arthritis.
Cognitive behavioral techniques and mind-body practices like yoga and Tai Chi improve mental health and resilience, which in turn support physical well-being.
Regular checkups and biofeedback monitoring enable early detection and better management of chronic conditions through ongoing measurement and follow-up. Gentle detox protocols, herbal teas, detox diets, and hydrotherapy support the body's natural cleansing processes without excessive stress.
Educational workshops and support groups on nutrition, stress management, and healthy living promote community-wide wellness and shared strategies for managing chronic conditions.
Genetic testing identifies predispositions to chronic disease. Epigenetic support through lifestyle changes can positively influence gene expression and disease risk.
The importance of vaccination, sanitation, and nutrition in disease prevention. Vaccination. 1. Mechanisms of action. Vaccines often contain weakened or inactivated parts of a pathogen, such as proteins or antigens, or a small amount of the pathogen itself. This exposure trains the immune system to recognize and combat the pathogen effectively if exposed again in the future. 2. Types of vaccines. There are various types, including live attenuated vaccines, contain weakened forms of the pathogen, e.g. measles, mumps, rubella. Inactivated or killed vaccines, contain killed pathogens, e.g. polio vaccine. Subunit, recombinant, or conjugate vaccines, contain parts of the pathogen, e.g. HPV vaccine. mRNA vaccines use messenger RNA to instruct cells to produce a protein that triggers an immune response, e.g. COVID-19 vaccines. 3. Global impact. Vaccination campaigns have led to the control or eradication of several infectious diseases globally. For instance, the Global Polio Eradication Initiative has drastically reduced polio cases worldwide. 4. Economic benefits. Vaccines reduce the healthcare costs associated with treating diseases and prevent productivity losses due to illness. They also decrease the burden on healthcare systems.
Sanitation. 1. Water and sanitation. Access to clean drinking water and proper sanitation facilities is crucial for preventing waterborne diseases like cholera and dysentery. 2. Food safety. Ensuring food is properly stored, cooked, and handled reduces the risk of foodborne illnesses caused by pathogens like Salmonella and E. coli. 3. Public health policies. Governments and organizations implement sanitation standards and regulations to maintain public health. Examples include guidelines for safe water treatment and sewage disposal. 4. Impact on disease transmission. Improved sanitation has significantly reduced the prevalence of many communicable diseases. For example, the introduction of modern sewage systems and water purification has been linked to declines in diseases like typhoid fever and hepatitis.
Nutrition. 1. Nutritional deficiencies. Lack of essential nutrients can lead to deficiencies that impair immune function and increase susceptibility to diseases. For instance, vitamin A deficiency can cause vision problems and increase the risk of infections. 2. Balanced diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports overall health and can prevent chronic diseases. Specific nutrients like zinc, vitamin C, and antioxidants play a direct role in immune health. 3. Public health initiatives. Programs that promote good nutrition, such as school meal programs and community nutrition education, help improve health outcomes and prevent malnutrition. 4. Impact on vulnerable populations. Children, pregnant women, and the elderly are particularly sensitive to nutritional deficiencies. Addressing their nutritional needs is crucial for reducing health disparities and improving quality of life. Vaccination, sanitation, and nutrition are interconnected elements of a comprehensive public health strategy. Vaccination prevents specific diseases, sanitation creates a safe environment, and nutrition supports the body's overall ability to resist illness. Together, they contribute to the reduction of disease burden and the promotion of health at both individual and community levels.
The effectiveness of naturopathic interventions in public health initiatives. Naturopathic interventions can complement public health initiatives in several ways, though their effectiveness often depends on how they are integrated into broader health strategies.